Hi, my name is Jonathan Ungar, and I am the medical director for the Waldman Melanoma and Skin Cancer Center here at Mount Sinai. So skin cancer is one of a number of types of cancer that arises from cells of the skin. We typically break them down into non-melanoma and melanoma skin cancers. And within the non-melanoma skin cancers, there are basal cell and squamous cell. Although there are a few other much more rare skin cancers, those are the big three that we talk about. In terms of how common they are, number one and number two on the list of human cancers in the United States are both skin cancers. In fact, they are the two non-melanoma skin cancers. There are approximately 3 million new basal cells diagnosed each year in the US. And add to that another million new squamous cell carcinomas or SCCs diagnosed in the US, and you have 4 million each year. If you add up all the other types of human cancers together, you don't get 4 million new cases in a year. So of cancers, they are definitely the most common. Fortunately, basal cell and squamous cell are very treatable. And so although they're common, we usually are able to handle them and people are cured and treated for it. Melanoma, there are approximately 200,000 cases of melanoma expected to be diagnosed in 2021. That includes melanoma and melanoma in situ, which is the earliest stage where it's just limited to the skin. Melanoma is a much more deadly skin cancer, and as such, it's good that it's less common, but it is also one of the ones that keeps us up most at night. Skin cancer can affect anybody who has skin, which means anybody. Fortunately, the non-melanoma skin cancers like basal cell and squamous cell are by far the most commonly seen in people 65 or older. It's not commonly seen in children or younger adults, but it is certainly possible. Melanoma, on the other hand, again, most commonly seen in older adults, but is one of the most common skin cancers in young adults. Fortunately, cancer in general is fairly rare, but among those rare cancers, it is one of the more common ones, and it certainly can affect children as well. As I mentioned before, basal cell carcinoma is the most common cancer in humans, and as such, it is also the most common skin cancer. That is followed close behind by squamous cell carcinoma, both in terms of all human cancers, but also in terms of skin cancers. Basal cell has typically approximately 3 million new ones diagnosed each year, and squamous cell carcinoma has about 1 million. When it's important to say that when we're talking about warning signs, that means what you're looking for yourself. There are certain things to look at, and I'll mention those in a moment, but none of this substitutes for regular skin checks with your dermatologist. I just wanted to say that out there, because unless you're a dermatologist yourself, there's a good chance that you're not really necessarily going to know what you're looking for. But when you're looking at spots on yourself, for non-melanoma skin cancers, in general, you're looking for spots that are skin colored or pinkish, that are growing, fairly rapidly, meaning not a growth that's been stable for 2 years, but is increasing in size. And often these will start to bleed or crust up on their own. Anything like that, especially in an area that gets a lot of sun exposure, the face, the head, the neck, the chest, the upper back, the hands, any of those is a reason to go see your dermatologist sooner than just your regular annual skin exam. In terms of melanoma or moles, there's something called the ABCDEs of melanoma. And this is a little mnemonic to remember the various characteristics. So A is asymmetry. We're looking for moles that are asymmetric in their shape. B is for border. The ideal mole has a perfectly smooth border. Irregularities of the border indicate that there's something maybe irregular with the mole. C is for color. So ideally a mole has a single color in it. Normal moles may have more than one, but having more than one color is something that might cause you to bring it to your dermatologist's attention sooner. Diameter, meaning larger diameter, the higher the risk. And then finally, the last one, which is maybe the most important one to remember, is E, or evolution. In other words, if a mole is changing in any way, and you're not sure whether that's a normal change or not, that's a reason to have it checked out. None of these by themselves indicate that a mole that is changing in some way is a melanoma, but these are reasons to bring you to your dermatologist sooner. As I mentioned, there are several types of skin cancer, and each one has different behavior. As such, the treatments that are appropriate for each skin cancer vary. For the non-melanoma skin cancers, for instance, on the face, on the hands, and other high-risk areas, there's a special type of surgery that's used to treat it called Mohs surgery, M-O-H-S, for those of you interested in looking into it further. There are topical chemotherapeutic treatments that can be done. There's a procedure where they can be frozen and burned. Those are appropriate for ones of certain size or certain subtypes, often on let's say the body, like the trunk or the extremities. For other types, surgical excision is the norm. When we talk about melanoma, again, melanoma being one of the more aggressive and sort of concerning of the skin cancers, treatment is multifactorial. It almost always will involve some level of surgery. This may always includes the excision, what we call a wide local excision, where normal tissue around the melanoma is excised and surgically removed along with the melanoma itself. In some instances, a sentinel lymph node biopsy is done to see if there's been any spread of the melanoma. And then beyond that, if it becomes more spread throughout the body, there are a series of various targeted therapies called immunotherapies that target very specific parts of cancer cells, the melanoma cells, and also the way it interacts with the immune system in order to treat them. Each skin cancer is a little bit different, but for the non-melanoma skin cancers, the most common cause is ultraviolet radiation, which is most commonly from the sun. This is part of the reason why sun protection is so important. The other thing to remember about these skin cancers is that they take many years of sun damage to form. So, the sun damage that occurs in our childhood and throughout our young adulthood comes sort of back and is cumulative to the point where when we get to be older adults, these tend to come out. There are other much more rare causes of these, but the vast majority are related to sun exposure. In the case of melanoma, it's a little bit more complicated. There are certainly genetic factors that predispose individuals to melanoma, and melanoma can arise in tissues, for instance, that don't get sun exposure. But to our best of our understanding, if you look at melanoma cells and you look at the mutations that occur to their genetic code, there's the signature damage in many cases of sun exposure. So sun exposure certainly plays a role, but it's not quite as big of a part of the picture, perhaps, as we see in the non-melanoma skin cancers. The type of skin cancer that keeps most dermatologists up at night most would be melanoma. Unfortunately, we can't undo the damage that the sun has caused to our skin in the past. Hopefully, and perhaps someday in the future, that will be something we'll be able to do, but at present, we can't undo that. So because of our sun exposure throughout our lives, regular skin cancer screenings is appropriate and important, although it's not necessarily preventive, but it allows us to catch things early, which always makes treatment easier and the outcomes are typically better. In terms of prevention, however, as I mentioned before, sun exposure and specifically ultraviolet exposure is the biggest factor in terms of developing skin cancers. And so to the extent that we can minimize our ultraviolet exposure, that is probably the most important thing we can do. That includes sun protection in the way of sunscreens, in the way of sun protective clothing, even things like sun avoidance. You don't have to go to the beach at 1 o'clock in the afternoon. If you have to go to the beach, you're better off in the early morning hours before 10 a.m. or in the late afternoon hours after 4 p.m. Aside from wearing sunscreen daily, and I personally recommend an SPF 50 or higher, you have to remember things like it needs to be reapplied every 2 hours. But some of the behaviors are actually even more subtle than that. So for instance, here in New York City, most of the time, one side of the street is sunny and one side of the street is shady. If you choose to walk on the shady side of the street every single day, or to the extent that you can, that can actually, over the course of many years, dramatically reduce the total amount of sun exposure you'll experience. So our new Melanoma and Skin Cancer Center here is something we're really excited about. This allows us to actually marry some of the more old school techniques, and by old school I mean the current techniques, such as total body checks. These are critical and there's no substitute for those. Or things like dermoscopy, which allows us to use a device to take a close look at moles, for instance, and look for certain patterns that might be indicative of abnormality. And that's something that you can get everywhere, but we've really been able to augment that and really, I think, increase the power of our ability to not only monitor patients at high risk for skin cancer, but to also detect melanomas and other skin cancers using several different new technologies. One of them that we have here is It's very sophisticated 3D total body photography that is very quick to do, and it allows us to make an objective record of all the lesions on a single person's skin as a reference point. The software actually itself is getting increasingly sophisticated, and the AI of the machine over time is getting better at even detecting things that might be considered abnormal, although it does not, again, substitute for a total body check by your dermatologist. But in addition to that, or in conjunction with that, we're using several other non-invasive technologies to either monitor or diagnose skin cancers. And this is important because, the main technique to prove that any given bump or mole or spot is a skin cancer is a biopsy. And although it's a fairly straightforward procedure, it does involve taking a piece of the skin. And when you remove something from the skin, it does leave a scar behind. And in some people, that doesn't bother them, and that's not a big deal. But in certain areas that are more sensitive, for instance, the face, where a biopsy leaves a scar, and if it's not a skin cancer, it turns out that was an unnecessary scar. The ability to make diagnoses through other means that are both reliable but also will not leave a scar is really great. And so we have a few imaging modalities that we use here. Reflectance confocal microscopy being one, and optical coherence tomography being another. And each, I won't go into the details here, but each plays a role and has a different role in this diagnostic and frankly in the treatment process. The other thing that we use here, which is very exciting for determining, it's a very quick procedure that allows us to tell if a mole has a high risk of being abnormal or not, again, in a non-invasive way. It's called electrical impedance spectroscopy. And so we use all of these together to really give our patients the really cutting edge in terms of monitoring and hopefully early detection and diagnosis of skin cancer, while at the same time not necessarily subjecting them to unnecessary scarring, which I think over the long run for people who have a risk of skin cancer, it means a lot. The last thing I'll say about this, which is that although each of these technologies do exist in different centers around the country, so far as we know, right now, Mount Sinai and our Waldman Melanoma and Skin Cancer Center is the only one that has all of these together under one roof and utilized in one center.